Good afternoon, everyone. As everyone else expressed, I'm really excited and honored to be collaborating with these amazing women on this study and be able to share space with them today. As Miriam mentioned, we did collect qualitative data from several groups, including women who are part of the 101 Women from Black Infant Health, as well as some stakeholders, including providers, community-based organizations and agencies, payers, and centering pregnancy experts. Today, I'm going to be sharing and focusing more on the qualitative interviews from Black and Latinx women. So due to time, I'm going to briefly highlight these things because I want to really allow some time for us to ask some questions. So if you have any questions about methods or anything that I present, please put it in the Q&A section. So we developed a semi-structured interview guide, and we went through 3 iterations of this guide. As you could imagine, COVID is new, and as we were collecting data, we were like, wow, that's really interesting, and we need to make sure that we're capturing all these things so that we have everything we need to revise GLOW. We did have racial concordant interviewers where we partnered Latinx and white women with Latinx women and Black women with Black women for interviews. And our interviews ranged on average from 23 to 96 minutes. All interviews were audio recorded and professionally transcribed. And we collected this interview data July through September of this year. Next slide, please. We had a diverse data analysis team of 9 coders. So we had 5 representing community or trained in community health, and 4 who were providers or had experience facilitating the group prenatal care sessions. We had the team review field notes and transcripts, and we developed and finalized a code book. And the team members worked collectively to code and adjudicate all of the transcripts and assign final codes. And we're currently using thematic analysis to analyze the data. Next slide, please. So we interviewed a total of 62 Black and Latinx pregnant and postpartum women. They represented 2 groups of people. So we interviewed 40 people from the Embrace 101 participants and 22 people from Black Infant Health. Next slide, please. So here are the demographic characteristics of the sample and just some key highlights of the overall sample. So the mean age for women interviewed was 27.2 years old, and approximately 42% of the population self-identified as Black or African American. And the majority of the sample had a high school diploma or higher, were married or living with their partner, and were born in the US, and had a monthly income of $2,000 or less. Today, I'm going to focus on preliminary data from the qualitative interviews related to COVID-related stress and anxiety, the impact of the Black Lives Matter movement, prenatal care experiences during COVID, and recommendations to improve GLOW. Next slide, please. So I'm going to allow you all to read this text on your own while I give some summary and big highlights. So women's COVID-related stress was nuanced and encompassed fears and worries about contracting the virus and also the financial burden it has caused for them and their families. Women described initial challenges accessing resources at the start of the pandemic, and the majority of resources and supportive services have now transitioned to telehealth, which has impacted low-income women in Fresno in different ways. Women expressed being financially burdened during the COVID pandemic, and many women shared that they and their families lost their jobs. Next slide, please. So during COVID, there's been an increase, particularly in social media, coverings of violence towards Black people in the US resulted in police brutality and hate crimes. So we felt like it was important for us to ask women how the Black Lives Matter movement has impacted their pregnancy and families. Black women in particular described increased anxiety and worry for the health and well-being of their Black sons. Here's an example here. Next slide, please. So the majority of women reported that they have been attending in-person prenatal care appointments during the COVID pandemic. Women have expressed enjoying in-person appointments due to the ability to interact with their provider and have a full health assessment and get real-time data on their health and the health of their baby. Women shared that the COVID pandemic has changed the way that they can access and engage in prenatal care. Women expressed that there are new policies to ensure the safety of patients, staff, and providers. And here is an example of what that new process looks like. So next slide. So we also asked women about recommendations. So although we said the majority of the women did have in-person appointments, there were some women who did also attend some virtual appointments. And here's what they wanted us to consider as we were revising the GLOW curriculum. So they said they needed access to diagnostic tools to be able to conduct their own vitals while at home. They wanted access to educational resources on how to use these diagnostic tools. They felt like it was important for providers and facilitators to do a home visit to really show them in person how to use these tools, because some people expressed that they are a person that learns by doing. A lot of women said that they needed technical support, particularly in having Wi-Fi to actually be on video, given that a lot of people were at home working and their children were also at home during school online. They expressed wanting providers and staff to have patience and understanding that COVID is new, and they have a lot of questions and really need help figuring out how to still get the resources and information they need about their pregnancy during this time period. Women also recommended having delivery and our pickup services for resources such as WIC. An example that was given was that you could, go to Target now and they can bring out your groceries. So how can we incorporate that model with supportive services? And then also a central platform to store health information. Women did express that appointments during the COVID time period are faster and they feel like they don't have a lot of time to ask questions. So just having a central location where they can get additional information would be helpful. Next slide, please. So here is how we are currently modifying GLOW. And these modifications are collective data from both the qualitative interviews as well as follow-up focus groups we had with women and individual interviews with providers, payers, community-based organizations, and experts in centering. So they recommended that the sessions will need to be flexible to meet the needs of participants and providers. So there are these two key stakeholder groups that need to be in constant conversation together and to make sure that technology access and privacy concerns are addressed and training and support for participants and providers. So this is new, not just for participants, but also for providers to be using these platforms. COVID-19 and the resulting of social distancing and shelter-in-place orders have compounded social isolation feelings. And so women expressed the importance of GLOW, things like GLOW, and really looking forward to have space where they can interact with other women to talk about issues that they're going through and hear how other people are solving these things. And so women did express gratitude to First Five for continuing to have sessions for them to meet during the COVID time period. And the GLOW program will need to adapt to meet the most pressing needs and to connect participants about changing community resources. And so women described like each community agency is providing resources virtually in different ways and really being able to talk to the GLOW facilitators to really walk them through those processes. And lastly, session scheduling should be mindful of barriers participants face, including responsibilities at home with children and work. And really, this ties into the thing around like privacy, what women could say and not say when they have other people in their homes. And so First Five is working on all these recommendations that has come forth from all these sources of data. And I am going to be handing it back over to Dr. Curry to close us out.